Obstetric fistula in Europe doesn't exist anymore since over 100 years. When patients need a C-section, cesarean, she will reach hospital. But in remote countries, in remote areas, in developing countries, the problem, the access to the healthcare is very difficult. The patients are not aware, they have no money, they have no transportation, and all these points are delayed to the delivery. In between, the baby dies. Then, the baby dead in the abdomen brings ischemic tissue on the vaginal wall, on the bladder, sometimes on the rectum. And at the end, what that means? The holes appear. That's the definition of the fistula. Its holes can be very big between bladder and vagina, between vagina and rectum. The lady who has some problem, and nobody then will take them back. And most of the time they are infertile because the uterus has gone during the obstetric fistula process. And this poor lady are completely left by themselves. When you consider that something can be done with good results, we can bring all our efforts together to help them. Tangueta is a small village in the remote area of Benin, a border to Burkina Faso. And this hospital, we have created a fistula center. That means we operate patients, we train a lot of doctors. We have a prevention program, we have a social reintegration program, and we have also a research program. In this model, we reimbursed the hospital for all the costs the patient should support, but as they have no money at all, somebody has to do it. Thanks to the program, the center is able to treat fistula patients all year, and we organize 4 dedicated missions per year to treat more complicated cases, because sometimes it's very difficult cases. But today, half of this mission over the year are run by African doctors. So our goal is to train the future trainees. And I think today we have almost reached this goal. We want to tell the communities that something can be done. These women can be cured. One of the issues of this kind of program, of course, is always money. To raise money for fistula is difficult because it's not glamour. It's when you talk about fistula, the foundation, the donors are not very eager to join you. And that's something difficult for us, is to have sufficient money to run our program. Because now, this model, of course, we try to export the Tangueta model in other countries, like in Cameroon, like in Madagascar, in Burkina Faso, in Chad, and in Mali. But some of these countries are now difficult to access due to security reasons.